HealthWorks, providing trusted, culturally appropriate information and resources. We aim to strengthen vaccine confidence and prevent outbreaks of vaccine-preventable diseases where we live, worship, work, and play. Increasing access to vaccine and booster shots for diverse, medically underserved populations. Engaging communities, families, and businesses in the fight against COVID-19.
Hello, I'm Kermit Payne with One Joshua Group. Thank you for joining us for HealthWorks, a podcast series devoted to reducing vaccine hesitancy in Georgia and Tennessee. Today, our guests are Dr. Eboni Haynes of ASHLIN Management Group, Dr. Donald Alcendor with Meharry Medical College, and Ms. Patrice Guzman and Famika Edmond with Black Girl Health Foundation. I am pleased to introduce to you Dr. Haynes, who will share with us information about the Black Girl Health Foundation and also introduce our guest from Black Girl Health Foundation. Dr. Haynes?
All right, so I think one of the great things about having Black Girl Health Foundation at the table is that the work that they do really centers around providing trusted and age appropriate information to college students. And they are working with not just college age women, but all college students in the areas where we are working in Georgia and Tennessee. And so having them on board with the experience in doing work and providing that information, that trusted information to college age students was of huge benefit to our program. When we think about when we started this program, that 40% of unvaccinated college students indicated that they'd leave their institution if their institution said that vaccinations were going to be a requirement. That let us know that there was a huge disconnect in, making sure that individuals had accurate information about the vaccination. We also recognize that, those students who indicated that they didn't want to get vaccinated were doing so because they didn't trust information that was out there, scientific information. They didn't trust information that the government was sharing. They were reading negative reports in the media about the vaccine. And we saw, depending on what part of the country you were in, differences in terms of whether college students wanted to get vaccinated or not. So if you were in a state that was more likely to have huge racial ethnic disparities in as it related to COVID-19, then those college students were more likely to be vaccinated. But if you were in a state where you didn't see or you didn't feel as closely connected to those disparities, then you saw students were not as trusting of the vaccine and they were more likely to be hesitant in getting the vaccine. So obviously, we have to make sure that we are doing all we can to make sure that accurate information is getting to those students and we're sending the right messengers to share that information with that population and increase vaccine acceptance and reduce those negative attitudes towards vaccinations. And the way that Black Girl Health Foundation goes about their work through the College Ambassador Program allows us to make sure that we're doing just that.
So, Dr. Haynes, share with us, and thank you for that, Dr. Haynes, the importance of what Black Girl Health Foundation does in addressing trustworthiness and the importance of having the appropriate messages and the appropriate messengers to look at college age students generally, not just women, but in Georgia and Tennessee. Patrice, would both you and Famika share with us some of your experiences in talking to these college age students where they felt more comfortable, more trusting because of the College Ambassador Program? Are there any things that you can recall at the moment that demonstrate the benefit of having a person of trustworthy nature like you and those individuals in your program?
I think that just with all of the ambassadors that are working on the program, they're learning so much and gaining so much insight and information that they weren't aware of even before they came on board with as an ambassador. And so they have really shared that they found some creative ways to interpret the information, and they've translated their interpretations into ways to effectively communicate with their peers. And so that's been great to hear that they're more comfortable disseminating the information. They have information that they trust. Um, and they feel comfortable with sharing the information, knowing that it's trustworthy to their fellow students. So that's been really rewarding to hear from each of the ambassadors.
And just to piggyback on what Patrice was saying, all of our ambassadors, they go through an onboarding and training process. So they do have access to reliable and accurate research that they have to use to disseminate when they do put out any type of information about COVID and vaccinations. They also have gone through the HealthWorks training as well. One of our girls just did a TikTok video using the motivational interview skills to be able to get the message out there. So it was pretty cool to see them take the things that they're learning from their trainings and from this experience to be able to disseminate the information out to their peers.
Well, that's encouraging. I guess that tells us that social media works. And I think we kind of know that. So, Dr. Alcendor, if we could, we know that, and Dr. Haynes alluded to this, um, issues around social, emotional, and mental well being of this population. How important is it going to be when we look at the outlook for young people going forward from the lessons we've learned so far through the pandemic? What should we do to better engage this population going forward?
So in the early days, we had some difficult days. We had school that just was no longer an option to go to. We had virtual school. We had a situation where young people were not allowed to get together anymore. We were all in a state of isolation. We spent the winter months inside. And the idea is that uh, all they could do is be on social media to interact with each other. And so that was difficult for them. We saw an increase in young people in terms of them experiencing anxiety, depression, trauma of all sorts. There were young people that were in college and they had to leave college and go back home. And for every student, going back home is not the best place to be. That's just the way it works out, meaning that going back home can represent a difficult time for some students. College, sometimes, for some students, is a haven, it is a place where they can be themselves. And going back home, they sometimes have to pretend to be somebody else in order to get along with parents. And so, what I'm saying is that we've seen an increase in sadness. We're talking about 1 in 10 students thinking about suicide during this pandemic. We're talking about people going through and participating in behaviors that they would never normally behave in because of this pandemic. We saw people develop eating disorders during this pandemic, having so much time on their own, no exercise, no interactions with others. We saw rule changes that came overnight that we had to abide by. We had confusion and we had misinformation mountains to climb. And we're still climbing them. Because when I go out and talk to young people in the field, they are telling me some things that defies logic when it comes to not wanting a vaccine. It just defies logic. And the idea is that I go with an understanding that education and awareness is absolutely necessary from here and beyond. And the idea is that it's a group of people that we're not talking about, and that is people that are vaccine resistant. And what that means is that, and I meet it every time I go to a vaccine event, this is a person that doesn't want a vaccine and they're adamant about not wanting that vaccine. And in certain groups, there may be a level of violence in terms of telling you that they don't want that vaccine. Another group that we're not talking about that needs consideration because they're among the most under-vaccinated populations that we're talking about. And that is in Tennessee, we have 95 counties, and most of them are rural counties. And when you go to rural counties, they will tell you, many of them are conservative counties, they will tell you they're not interested in the vaccine, and they're not interested in talking about or learning about vaccines. And so you have to go through a myriad of attitudes and the way people feel about a vaccine. And I go to a place and start talking to workers that were trying to get vaccinated. And the workers' greatest fears is that he doesn't want a vaccine until Tony Fauci is arrested. You see what I'm saying? Meaning that not wanting a vaccine has nothing to do with the information about vaccine or how safe and effective vaccines are. And so going forward,
Yeah, and Dr.
Mhm.
Alcendor, that's really great information. I was curious to find out from Patrice and Famika, are those some of the same kind of questions that you're getting from college age students in your campaign?
Absolutely. And so I went recently to a homecoming event on an HBCU campus. And we engaged people routinely about whether they wanted a vaccine or not. And all I heard was, I don't trust the government. The vaccines are not safe. I've heard of people have side effects that would put them at risk of not having children in the future. So I've heard the whole gamut of things in terms of affecting fertility. And I can tell you one thing: if you tell a group of young males that uh, getting this vaccine might cause you to have erectile dysfunction, you're going to be done with that particular group of young males, meaning that your ability to try to change their minds is going to be problematic, meaning that that is something that even if it has a chance to happen, they don't want to be a
Mhm.
part of that.
So, Patrice and Famika, are those consistent with your experiences in the areas where you are reaching to change vaccine hesitancy?
Yes, those are definitely some of the concerns that have popped up on our ambassadors' radar. Also, the biggest misconception is that our ambassadors are getting is that when they get the vaccine, they're actually infected with COVID. So that's another big one that our girls try to eliminate that myth about COVID and the whole vaccination process. But yeah, it's very consistent with what Donald said.
So this is considerable information, and I want to ask you, Patrice, and you, Famika, what have you done extremely well, and what are you most proud of in this college ambassador program? And lastly, how can we reach you if someone is interested in learning more, first of all, about Black Girl Health Foundation, and secondly, about the HealthWorks program and the college ambassadors? How do we reach you?
Sure. Well, some of the things I think we've done really well is we've really tried to reach college students where they are. And so our ambassadors have done a great job being on campus over the summer and going into the new school year and really spreading the information and also just creating a wealth of very creative content for social media channels because that's how we've really been successful in reaching this age group. So they've done a great job with different videos for TikTok, for Facebook, for Instagram, just really trying to bridge some of those gaps that exist and eliminate those myths that are out there. So I think that we've done that really, really well, also through the dissemination of the newsletter. Um, you can always reach out to Black Girl Health Foundation through our website. I am listed on there. And if you'd like more information about the campaign, you are able to subscribe to the newsletter that goes out each week and disseminate some of this great content that the girls are producing as well.
And Dr. Alcindor, we want to just take 1 or 2 minutes to talk about the pediatric population. We've looked at the college age, but we want to be sure that we get a chance to talk about availability and the importance of pediatric in this discussion. Can you take a minute or so and talk about that before we close?
So the eligibility criteria for pediatrics has changed. Right now, 6 months and older, you are eligible for either the Pfizer or the Moderna COVID-19 vaccines. These vaccines are available. We have a number of back to school campaigns that are very important. Even though children are relatively asymptomatic after getting COVID, they still can get sick if they have underlying medical conditions. Young children can get long COVID, and if you have children that are obese, there are some studies that suggest 60% of the children that were hospitalized with COVID were obese. So, what I'm saying is that children are not all healthy. Some of them have underlying medical conditions that put them at greater risk for COVID 19. And just because they've recently been put on the eligibility as an eligibility group, they are under vaccinated at this point. And whether we like it or not, parents of young children from my time in the back to school pediatric clinic here at Meharry, they are very reluctant to vaccinate their very young children. And so this is something that we're working on. I am proud to be a part of the Tennessee SEAL. I'm the director of the Tennessee SEAL research program, and I'm working with HealthWorks as well. And just want to say hello to Miss Eboni Haynes, who's also working with HealthWorks. And so we need children, we need parents, we need opportunities to engage parents, to be able to tell them what they need to know to consider the COVID-19 vaccine for their child. And the idea is that we want parents to understand that our message is not a message of coercion. It is a message of information that will allow them to make an educated choice about getting a vaccine for their child.
So, Dr. Alcindor, so thank you very much, Dr. Haynes. Thank you very much, Ms. Guzman, Ms. Edmond. And I think one of the most important aspects of this discussion today is that HealthWorks is meeting people where they are. You can find out more information about HealthWorks at www.healthworks.health. I'm Kermit Payne with the One Joshua Group. Be kind, and most of all, be compassionate.
We would like to thank our special guests for joining us today. This HealthWorks podcast series is supported by the United States Department of Health and Human Services and the Health Resources and Services Administration. The contents are those of the speakers and do not necessarily represent the official views of, nor an endorsement by, HHS, HRSA, or the U.S. government. Don't forget to subscribe to receive notifications about future episodes, and be sure to share this information with your family, friends, and colleagues. Here's to bringing about a great change and improving health. Until next time, stay safe, be kind, and be compassionate. HealthWorks, providing trusted, culturally appropriate information and resources. We aim to strengthen vaccine confidence and prevent outbreaks of vaccine-preventable diseases where we live, worship, work, and play. Increasing access to vaccine and booster shots for diverse, medically underserved populations. Engaging communities, families, and businesses in the fight against COVID-19.